Hello, everybody. My name's Liz England. I'm a GP and I've got a long interest in children and young people's mental health. Can you all see my presentation? Can I have a thumbs up if you can? Yeah, I'm sharing properly. Good. Okay. So I've got that many things open. I'm trying to coordinate things. So I'm going to talk a little bit about Mindsafe, which I've co-founded with my colleague Charlotte Hodivala, and how that fits into wellbeing, inclusion, and digital technology. So, what is wellbeing? Well, it's more than just being happy. Wellbeing is personal and subjective, but it's also universally relevant to all of us. It encompasses environmental factors in our lives, so our experiences and other areas such as our health, physical and mental, academic attainment, job status, many different areas. And also wellbeing crucially recognises the different aspects of our lives that we determine ourselves. So through our own capabilities as individuals, how we feel about ourselves, the quality of the relationships that we have with other people, our sense of purpose. You can see from this slide that although there are some areas of overlap between adults and children, there are also differences, and that reflects different priorities that we all have as our lives change as we grow up. But there are those similarities that are there. So relationships, security, feeling of happiness, accommodation, which is slightly different in terms of how we feel in terms of home, for example. The difficult thing with all of these is deciding with which to give priority to and how much impact they each have on well-being. And studies haven't been able to show us that so far. It goes back to each part is part of a whole. And sometimes it's also a trade-off of different experiences. So our overall well-being is good, but that's only by trading off certain other areas. At school. So there is evidence from studies in the UK and USA, amongst many others, that there's a correlation between well-being and performance. So when they've assessed performance at the same point in time for different age groups, those that have better well-being have better performance, and that is quite a long-lasting effect that was still maintained 2 years later when they remeasured. Furthermore, there's growing evidence that well-being and learning are inextricably linked. Recent research has shown that better well-being is associated with more adaptive forms of motivation, so wanting to learn and progress, rather than purely focusing on performance relative to others or avoiding learning situations. Well-being is also linked to engagement, and there's an annual study that looks at happiness in children and young people, and that's shown that those with better well-being have better levels of attendance and lower levels of truancy. For poor well-being, there are lots of different negative outcomes. One of those is poorer mental health, and we can see from this slide over the last 3 years with the pandemic, children's well-being has significantly dropped, and that's reflected in the fact that the likelihood of having a mental health problem has increased dramatically. I think key to all of this, amongst perhaps teachers in both junior and senior school, is the fact that we know that by time people reach 14 years old, so as early as 14, most will have already developed or be developing part of their mental health problem as an adult. So 50% of all mental health problems start before the age of 14. So a huge area and opportunity for intervention there. Prevention is always better than cure. Well, I agree. As with many things, in terms of preventing, it's better in terms of resources, cost, missed opportunities that young people undergo. And the Chief Medical Officer for Public Health England identified that early intervention is key to providing effective support. And these 4 areas here, prevention, identification, early support and access to specialist support, are really important. So prevention is creating a safe, calm environment where mental health problems are less likely to develop, improving the mental health and well-being of the whole school population, and equipping pupils to be resilient so that they can manage the normal stresses of life effectively. Identification, recognising issues early and accurately. Early support is helping pupils to access evidence-based interventions. And access to specialist support is working effectively with external agencies to provide access to referrals to specialist support and treatment. In terms of wellbeing and inclusion, again, intimately linked. Within a school context, inclusion is often referring to support or additional support for those groups of children who may struggle to access resources in an equal manner. And that can be for many reasons: behavioural, mental health, physical health, environmental issues. Just makes things more difficult. Also, inclusion tends to be negatively considered as part of behavioural and exclusion policies, rather than being seen as a virtue, a whole school virtue, and part of that whole school wellbeing policy, inclusivity. In terms of what's currently available, schools are required to deliver on a number of areas, which I've listed here, and some of the more recent areas of development are senior mental health leads being trained up, mental health support teams, which are a specialist sort of level intervention service that will be going into schools, although there's not that many of them at the moment. Support tends to be more of the DFE websites, downloading lists of mental health and wellbeing resources. And one of the things that I think is quite important, Mind published in 2021, a study, Not Making the Grade, which looked at secondary schools and what they were offering amongst all of those things I've just mentioned. And as you can see from this one statement that the children were asked to agree with or disagree with, there isn't actually in this study a huge amount of support for their mental health delivered at school. The other important figures here are, and this is from NHS Digital, 34% of those children who are referred into NHS services don't get accepted. So that's referrals into CAMS or the mental health support teams. And 70% of children and adolescents who experience mental health problems have not had any early interventions. So that's 70%. So what is digital wellbeing? Well, it's a term that's used to describe the impact of technologies and digital services on people's mental, physical, social and emotional needs. For children and young people of today, obviously, they are completely immersed in the digital age. It's an integral part of their lives, every part of their lives, and increasingly so for adults too. Digital wellbeing offers a number of ways of meeting demands where there is a resource gap. So things like the mental health support teams, CAMS, things that they are specialist and expensive. Face-to-face appointments are expensive, both in time and financial resources. And there is this gap between what you provide for children that don't need or meet those criteria, but they need something. And this idea of proportional universalism, where we want everybody to have something, but those children with greater need have resources more focused, which is a fairer and more equitable way of delivering wellbeing. And in the NHS, we are using a lot of apps to monitor children's wellbeing, to get them to complete mood diaries, and to then when they come to appointments, they can bring that information with them. We can review it together. So we are starting to move into sort of the 21st century in the NHS. So how can Mindsafe help with all of this? So There are a number of digital options available currently, but many are not specifically designed for children, or they only offer one part of what I will talk about in a moment, which is part of the Mindsafe toolkit. And what we've tried to do is combine all of these parts to give one accessible, useful toolkit. And Mindsafe is designed to be part of a whole school approach, so it doesn't exist on its own, it has to exist within a range of offers. So we have mood diary monitoring, reflective journaling, which we have tried to make as accessible as possible. Children can upload videos, they can use emojis, they can use tags. They have an About Me page, which we've tried to make transferable, so this can be downloaded and used in other scenarios. A talk facility, which is where if there is a greater need for and positive and negative things to speak about things, they can safely contact somebody within the school to talk about that. We've used what we call a red flag word safeguarding system. So whilst this is a child's unique and personal account, if they do use words which we have found from an evidence-based review of text-based crisis apps, if they use certain words, we can alert the school so that they can decide if that's something, say for example they use the word murder, that's something that we can feed back. Schools get real-time feedback on pupils' wellbeing with a dashboard, feeding back constantly the different years, different age groups, genders. You can have specific features set up depending on what type of things you want to monitor within your own school. We've also added a structured survey facility, which is perhaps what you're more used to in terms of how you survey wellbeing within schools. So an annual survey, for example, and recently an anonymous concern reporting tool, so children can completely anonymously report concerns about anything through the toolkit. And we've got lots of links to educational tools and resources within the toolkit. We also provide nudges for students to remind them about healthier behaviours, remind them to log on, remind them to do various things because they need reminding a lot. So I'm going to show you a little video of just the main parts of it. You may have to watch a little bit from Grammarly first, sorry. It's, if anybody wants to ask questions, please do, that's fine.
Thank you so much, Dr. Liz. That's really, really good. And I mean, I think I know from our point of view, obviously mental health and well-being and providing counselling and other things for our students has been particularly important following the pandemic. I'm just wondering if you've got anything specific to say about that and about how we as schools are supporting students in adjusting to that new life.
I think measuring it is the most important thing. I think you develop your strategy, and that's a relatively easy thing to do. You go away and there's plenty of information out there, but I think you actually need to check that you think what you're doing is what you think you're doing, because counselling, again, it's a restricted intervention. There's only so many people can be counselled. And actually, are you putting through the people that need the counselling in the first place? There's a lot of interventions you can do before that part. So for me, it's making sure you've got a whole school strategy, which is sort of a funnel downwards. And I think, yes, counselling is part of it. There's also then the more specialist teams. But I think if you can get in early, which is what we've always said in the NHS, if you can get in early, you may not need the counselling. So that would be my ideal, that nobody needs these teams.
Great. And how many, I don't know if you mentioned this already, but how many sort of schools have you got using the system currently, and how many students sort of are doing mood diaries through it?
My colleague probably be able to give you more exact numbers, but there's at least, we've got at least 30 schools at the moment now, which about over 25,000 logins on our system. So we've got quite a lot of data, and we use that data for the benefit of schools. We feed back to schools how their school is doing compared to other school, all anonymously, obviously. But, you know, I'm just doing some reports now for schools, which is looking at quite a few schools have had higher levels of anxiety this year, and with the mood diary monitoring. So I can compare their levels with all of the schools and all of the children in that area, and then some schools haven't. So what are they doing that's different? So I think it's, you know, that is the benefit of having big data that we can give back to schools. So to answer your original question, we've got at least 25,000 logging in, and at least 30 schools. I couldn't tell you the exact number though. I'd have to sit and count them.
And last question from me: how if people on the call or people watching on YouTube are interested in finding out more, what should they do?
So I've put our details on these on the last slide. So I presume the slides will be available. Yeah. So just contact myself or my colleague Charlotte, and we're both very happy to talk things through and to show you a bit more, because obviously that was just a very small snapshot of what we can do.
Great. Yeah, if you'd like to send those slides over to me, and I'll make sure that they're made.
Will do. Okay, lovely. Thank you.